According to the Centers for Disease Control and Prevention, a small number of pets worldwide have been infected with the virus that causes COVID-19. Coming up on this episode of the Paw Report, we're joined by Dr. Will Sander, an assistant professor of preventive medicine and public health at the U of I College of Veterinary Medicine. He'll talk about the risk of spreading the virus from animals to people and people to our pets. Stay with us.
Finding a solution for your pet's behavior problem can be confusing. Dr. Sally J. Foote helps you help your pet. Private consultation and resources are available at drsallyjfoote.com. Foote and Friends, better bond, better behavior.
Fetcher's Pet Supply on the north side of the Charleston Square, serving the EIU community since 1991. Fetcher's welcomes all pets on a leash, is open 7 days a week, and offers made in the USA food. Pet supplies for dogs, cats, reptiles, and fish. Fetcher's Pet Supply in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
And thanks for joining us for this episode of the Paw Report. I am your host, Kelly Goodwin, and today's episode, well, we take kind of a serious tone to today's topic. Of course, most everything in our daily lives, it seems like these days, centers around, in some shape or form, COVID-19, and that's no exception for today's episode. And we're joined by Dr. Will Sander, and he comes from the University of Illinois College of Veterinary Medicine to talk about COVID-19 and its association with our pets and kind of vice versa too, how people can have an effect on pets too when it comes to COVID-19. Thank you for joining us. A very timely topic. We are recording here in the summertime, but you know, as we talked earlier, this COVID-19 is ever changing. So thank you for joining us today. Dr. Sander, tell us about you, your background, and kind of your role at the University of Illinois.
Sure, happy to, and I'm happy to be here. It's certainly a hot topic right now, and it's touching all of our lives pretty dramatically. I went to veterinary school and graduated a little over a decade ago, but I really enjoyed the fact of the connection between animals and people, and so I went on and did a master's in public health after that, and so I really enjoy the intersection between humans and animals, and there's a lot of overlap there, from diseases to food safety to companionship and welfare issues too. Through the last 10 years, I've done small animal practice in dogs and cats for about 4 years. I spent time in DC for 6 years. 2 of those years with the Environmental Protection Agency, actually, looking at drugs and how they get into our environmental systems from both humans and animals and how that can affect us. And I spent time after that with the Department of Defense, actually, for 3 years, and we tried to build capabilities and capacities around the world in both human and animal health to detect diseases like COVID-19, actually. So I've worked in 15 different countries, trying to help build some of those capacities and help train people better and recognize these diseases sooner. And so we're always looking at the next possible pandemic or the next emerging disease that could happen, and what can we do about that? And so I transitioned about 2 years ago to the University of Illinois here, and I'm from the Midwest originally, so it was nice to come back home. And my role there is really to help train the next generation of veterinarians, and veterinarians who are interested in public health. So we actually have a degree program at U of I that lets veterinary students get their master's in public health at the same time. And so that's what I help run there, and I obviously lecture and teach and do research and things like that too. All this intersection of one health, the idea of human health, animal health, and environmental health connected together. One of my projects is looking at India at a tick-borne disease there that affects monkeys and people with a lot of fatality. I also have a project looking at surveying veterinarians in the Midwest and how are they disposing of drugs and pharmaceutical stuff and how can that affect our environment down the road. And I have another project with some Carl researchers, the hospital network here, looking at depression and pet ownership. How is having a pet, does that have a positive impact on mitigating depression? Does it not? We don't know those answers yet. So that's just kind of a sampling of some of the things I talk about and delve into for my research. But it's such a wide area. There's so much overlap. And I think we're realizing that with COVID-19 right now.
Sure. Would you agree that probably our very publicized health crisis over the last several decades does link back to animals? And what I'm asking is your SARS, your HIV, your COVID-19?
Public health is so complex, and we've had a lot of great victories over the last century in public health. But there's a lot of new and emerging diseases that are coming out in the last 2 or 3 decades. And so this is certainly not a unique virus from that standpoint. We've had other ones happen. HIV, as you mentioned, was originally a zoonotic disease, and it spilled over from other primates and came to us probably about 70, 80 years ago, and then adapted to just being in us. We've had cases now, obviously with Ebola it's been a big news story with West Africa about 5 years ago, and then more recently in the Democratic Republic of Congo. Again, we think bats are the host for that virus as well. And so we just have these bigger intersections that constantly occur with spillover. We've had a previous SARS virus that caused problems in 2003. For those of us who are old enough to remember it, talking to my students, most of them don't, but a lot of us do, and that stayed mostly in China, but it's very similar to what the SARS virus we're dealing with now is with COVID-19. So there's going to be constantly these new viruses that come into being, and the big drivers for that really are the fact that we're getting more and more people living closer together. Urbanization's becoming bigger around the world, and then we're also expanding kind of our impacts. We're encroaching more and more on wild habitats, and so ourselves are interacting more with wild animals. Our livestock that we rely on heavily is interacting with wild animals. So it just sets up this perfect interface for potential more interaction and spillover of these viruses.
Are there a lot of animal-borne diseases that are out there that we can actually pick up?
There are, and for most of us, if we're healthy, we're not in an at-risk population, the risk is pretty small, thankfully. But I mean, even our pets, as we'll talk about a little bit here too, I mean, there's over 50 diseases that CDC documents that can spill over from cats and dogs to us. And so that's why it's really important to keep that in mind, regardless if we're dealing with a pandemic right now or just our normal interactions with our pets. There are diseases we can catch from them. And so this is not unique. Certainly this is a new virus, and it's certainly causing a bigger effect because we're not immune to it. But it's not a unique situation. There's lots of diseases that can spill over.
How are animals specifically being affected by COVID-19? I guess essentially is, what do we know about animals and COVID?
Yeah, so a lot of the research is still emerging. We're 6-8 months into this pandemic, but there's been some studies that have really looked intensively at what animals could be most affected. And we know that cats and ferrets are probably some of the most susceptible pet animals that we deal with that can get COVID-19. And typically they're getting it from us. So we haven't really documented great cases where it's spreading animal to animal, cat spreading to another cat. And so it's usually almost all the cases in the US so far, and we have, as of now, about 10 dogs and 10 cats that have been diagnosed positive in the US. They've typically come from households where there's a positive human case or a suspected positive human case. And so it's likely coming from us, spilling over to them. Mm-hmm. And then the range of effects can be pretty varied, right? So we can have, a lot of them don't show any clinical signs. They don't get sick really from it. But we do have some who do get some sickness. They get some upper respiratory issues, trouble breathing, some coughing or sneezing, runny nose. And some of them, it affects their GI system. It actually gives them like diarrhea or vomiting. And so, those are kind of some of the signs that we get concerned about when we're looking at our pets and trying to see what are possible reasons for what could be causing them to be sick in the first place.
Let's talk a little nitty-gritty about COVID-19, because I think everybody kind of lumps the virus as one, and that's not really so. Specifically in pets, I guess I'm talking about, because we talk about COVID-19, but I'm interested in SARS CoV-2. That is the virus causing COVID-19. I'm sure I'm botching that, so I'm going to defer to you. But it's not all lumped, it's not all created equal is what I'm trying to ask.
I don't think you botched that question at all. I think it's a great question, and there's a lot of jargon and names being thrown around right now, from just using coronavirus to using COVID-19 to some people have heard about SARS-CoV-2. It's mainstream news now. And you're right that coronaviruses in general are a huge family of viruses. There's over 1,000 plus viruses that are in the coronavirus family. And so there are coronaviruses adapted specifically for different species. We have a coronavirus that exists in dogs and in cats. We have one that exists in cows. And those have been there for a while. We have some vaccines that work somewhat on those specific coronaviruses. But SARS-CoV-2 is the current virus that we're dealing with. And SARS stands for severe acute respiratory syndrome. And so it's named very aptly, right? That's what the signs are we see in people. And then CoV-2 is just the strain of coronavirus 2 that we're dealing with. And then COVID-19 is the actual clinical manifestation of SARS-CoV-2 in people. And so COVID stands for coronavirus disease, so they shortened it to COVID, and 19 is for 2019, which is when the virus was first emerged, as we look back and figure out how this all started in the first place. But when you use COVID-19, it certainly speaks specifically to what we're dealing with right now, but the actual virus is SARS-CoV-2.
You mentioned that worldwide there are a handful of animals, cats and ferrets specifically, that have come down with COVID. Can the same be true reversed? Can we get, if our pets have COVID-19, we don't know it, they don't display any symptoms, as you mentioned, is it something that we can get from them?
Yeah, so it's a great question. That's the magic question. That's the magic question, right? For all of us, we all want to know, is this really the biggest threat, right? Could we get this back? It could be a zoonosis again, right? And spill over from animals to people again. And right now, all the evidence says that we don't have that risk, really, or that the risk is very low. And so there's been no documented studies that show we can have it spill over from our pets, our pet animals, to ourselves. We haven't seen any new human cases where they've been in contact with infected pets that they weren't already documented as positive. And so the risk is, I would say, minimal to low. And I think that's probably going to hold true as we move forward. We have, millions of people now who have been infected with COVID-19, and we still have, a relatively small handful of pets that have been documented positive. And so I think the risk from this is very small. The real risk from COVID-19 is human-to-human transmission. So.
Well, I guess then my next question was going to be, can you get it from like your pet's coat? Because that coat does store a lot of stuff.
Sure.
Dander being one of them.
Yeah.
I'm sure you've probably had people ask that question. Saliva's been the first and foremost, topic of us humans. So I'm assuming that at this point there's been no documentation on just petting your pet can cause that.
Yeah, so we haven't looked specifically, there haven't been good studies out there at least to specifically look at hair, dog hair, cat hair. But we have looked at a lot of other surfaces in laboratories, and so we know that's where some of the early information came out that plastics and metal surfaces, which are pretty solid, impermeable, can potentially have virus on it for 3 to 5 days. Real world scenario, it's probably less than that. But a lot of these more porous surfaces like cardboard is not nearly as big of a risk, like less than 24 hours. And pet hair certainly falls in that category, right? It's a lot more porous, there's a lot more, I always say, topography to it, right? There's a lot more bumps and a lot more places for the virus to settle. And so the chance of us then petting that pet and bringing it in contact to us is pretty minimal. So I, again, put that risk quite low. Whereas that owner who's handling the pet who might have COVID-19 is more likely to spread it to you just being in proximity to that person than that person then getting, talking to them and getting it on the coat and then you picking it up from them.
There have been a number of reported cases, not only in our county here in Coles County, but all across central Illinois, hundreds of cases actually. How should a person handle themselves if they have tested positive for the virus and they have animals at home? Do they have to take any sort of special precautions? You've seen the photos out there where pets are wearing masks. Is that too extreme, or is that practice that people should be thinking about in their homes?
No, it's a great question. There's a lot of great photos out there, which are great photo opportunities
Yes.
of having
Yes.
pets in masks, and some of them look really cute, right? But no, I think that's taking it too far. So again, as I mentioned, there's really minimal chance that we're going to get it passed from pets to people, and the mask is really protecting the people around us, right? The mask isn't protecting you as much. And so there's no point in having a mask on a pet. And then from the risk of how, what we should be doing if you test positive or you have symptoms coming down. You should really, the CDC website actually does a great job. There's a CDC section specifically on if you have pets. And that link is fantastic for looking at. And basically what they recommend is just like if you were positive and trying to interact with another person, you should try and isolate yourself, right? You should minimize your contacts. So if you're positive with COVID-19, you should try and have somebody else take care of your pet if you can. Or if you have to handle your pet or take care of them, you should be wearing your mask inside the house with that pet, again, minimizing the chance of spreading the virus to them. Washing your hands before and after handling your pet. Same thing if you're before feeding them. Again, the best practice is to have somebody else take care of your pet while you're dealing with the virus. Just to, again, minimize that chance that we're going to spread that to a pet and potentially get them sick too.
Our discussion has thus far been limited to, domesticated animals, small animals, dogs, cats. Have any livestock tested positive? Can they have the same effect as domesticated animals?
Yeah, that's another good question, and I'm glad we brought livestock into it because this is the PAW report. But livestock certainly plays a big role, and they're really important. But right now we don't have any really good documented evidence of livestock getting this virus, which is good news. I think there's a lot more research that needs to be done for that too. They have done some looking at certain livestock species in laboratory settings and haven't found them to be really easy species to take on this virus. But we need more work to try and figure that out. I think still. So at this point, the risk is minimal, but the same guidance we have for pets, if you come down positive with COVID-19 and you're taking care of your larger animals, you should do the same sort of practices too, that try and wash your hands, have a mask on, all those sorts of things to, again, minimize the risk.
What should a pet owner do? And I guess one of the magic questions is, can you have your animal tested to see if they are asymptomatic or positive?
Right. No, it's a really good question. It's a big concern in a lot of pet owners' minds. So your veterinarian's always your best spot, right? I'm obviously a veterinarian, and I'm not trying to be biased about that, but your veterinarian, your relationship with your vet is the best place to go. So if you have a question about some sort of signs or symptoms that your pet is showing, you should reach out to your vet, reach out to the vet office and figure out, what should we be doing? How can we work on figuring out what's going on with your pet? Fortunately or unfortunately, the signs that pets get from COVID-19 are kind of vague and similar to a lot of other diseases that they could get, or a lot of other reasons they could be showing those signs, from allergies to lots of other more common viruses that they get. And so working with your vet, you want to make sure that all those other things are ruled out, because those are way more likely than COVID-19 to cause signs or symptoms. And if we're still stuck at that and your pet is still ill, then you can have that discussion with your vet. Right now, testing for pets is really contingent on working with the state veterinarian for each state, and there's a state public health veterinarian actually for each state too. And the two of them actually help decide if pets are actually going to be tested for it. We're really prioritizing people being tested right now for good reason. And so testing pets is low on the list. But again, if there's a big enough concern and you're working through all the other possibilities for why your pet might be sick and still don't have an answer, that might be something to talk with your veterinarian about.
Nausea, it could be vomiting, it could be lack of appetite, it could be fever. I mean, all the same things that us humans get as well. So your first line of defense is always, of course, check with your vet. How can we protect our pets? I know that sounds pretty simple because our first forethought is to protect ourselves. We wear masks, we keep distance. Is that the same practice you should be doing with your pets? Should you keep them away from large public areas where they could, maybe not having pet play dates? I mean, what's kind of your thoughts on that?
No, it's a great point. I mean, the same practices we're doing for ourselves, we should be extending to our pets too, because again, they could be an extension of spreading things or, potentially interacting with others. So again, I would avoid dog parks right now. You can have maybe a dog play date, but you really need to know, is that other owner, that other dog or pet or cat pet parent, are they feeling well, as, making sure that all those things are good. Same things you would do for interacting with another person right now with COVID-19. And for indoor-outdoor cats, really recommend keeping the cats inside, because again, cats are one of the more likely species that could get this virus. And so wandering around to somebody else's yard and potentially picking up COVID-19 from somebody else in your neighborhood who might be positive with COVID-19, right? So those are good practices to have in place. It's frustrating. We want our pets to have fun. We want them to interact. Just like all of us, we want that social interaction. But for right now, that's the best guidance.
It may sound like a strange or silly question, but I actually did have somebody ask me this when I said, I'm doing this topic. So I said, the show's coming up, I'll ask. Would game meat be safe to eat during a pandemic? I mean, we don't really know about wild animals, I suppose, and that is a food source for a lot of people.
And hunting season's coming up,
right?
And so, really game meat should be completely safe, right? And so there's two main reasons why it should be safe. One is the fact that the stomach acids in us typically are going to break down coronavirus type things. It's a respiratory virus, so if we're eating that game meat, by the time it gets into our stomach, we're going to break down that virus. And two is that at temperatures above 149 degrees Fahrenheit, which hopefully you're cooking your game meat to that temperature anyway, that's shown very conclusively to kill coronaviruses in general too. So those are the two main reasons. Not to mention, we don't think that wildlife, deer or things like that are big carriers or potential carriers for this particular virus. So we should be quite safe come hunting season.
There's still a vaccine, at least when we're recording. We're recording this in the beginning of August. It will air at a later time. But as we sit here today, no vaccine yet for humans. Magic question is, anything out there yet for pets and animals, or is that still being evaluated?
Still being evaluated. So as I mentioned earlier, there's a coronavirus that's in dogs and cats, and so we do have a vaccine for that. But it's not very effective. And that's a struggle with a lot of coronaviruses and other species too. So this is one nice thing about having a veterinarian pull knowledge into public health, and there's a lot of us doing this sort of thing, is we know from a lot of studies that coronavirus vaccines are pretty tough to be effective and last for a long period of time. They usually only generate immunity for 6 to 12 months, and you have to have a couple different doses. And so that's gonna be the big story I think we're gonna have to find out, is how well this new vaccine or vaccines that are being developed right now, how well are they actually effective? And they're really going to be targeted, obviously, at us, right, first,
Sure.
right? Especially the at-risk populations for us too, whether it's the older populations or those frontline healthcare workers or teachers. That's where the vaccine efforts are really going to be put towards. So I think developing a vaccine specific for this virus for our pets is probably unlikely. I don't think there's going to be a big enough market or need for that in the future. But I do think it's important that we look at other veterinary vaccines for other coronaviruses and figure out other lessons to be learned from that, and how can we make this new vaccine the best it can be, so we can all get back to a more normal sense of life.
Getting back to a more normal sense of life, if you had to put a crystal ball in front of you and look ahead, where do you see this falling? I mean, where do you see this going as a researcher?
Yeah, I mean, I think there's a lot of concern and trepidation right now, especially as schools, right? According to early August, schools are coming back into session, both from kindergarten all the way up through our university. How is that all going to be handled? And as these students come back together, even if it's a limited amount of time, how much are they going to be contributing to spread and potentially amplifying or making this worse? And that's something I'm curious to find out. I'm also a little bit dreading to find out how that goes too. I do think there's a lot more awareness now than there was 6 months ago, right? And so I think a lot more people are taking this very seriously, and hopefully that'll help push the conversation forward and get more resources put towards it, have people take this risk seriously, and really put the pieces together to hopefully make sure that we can still have great education for all of our students, while still protecting ourselves too.
A great way to end the discussion, and I hope we too help push the conversation a little bit today with this segment. So Dr. Will Sander, thank you so much for joining us today to enlighten us on COVID and our pets. We appreciate that, and I know if anybody out there has any further questions, they'll probably seek you out at the University of Illinois College of Veterinary Medicine and Hospital and College. So thank you so much for joining us today.
Yeah, happy to answer any further questions, so thanks for having me.
Great. And thank you, our viewers, for joining us here on the Paul Report. I'm your host, Kelly Goodwin, and we'll see you next time.
You're doing all you can to keep your family safe during the coronavirus pandemic. But what about the furrier members of your household? At this time, the risk of pets spreading the virus that causes COVID-19 in people is considered low. But it does appear that people can give the virus to animals, with preliminary research showing that cats and ferrets are more likely to get the virus than dogs. Until we know more, here's how you can help protect pets from possible infection. Don't let your pets interact with people outside of your home. Keep cats indoors. Walk dogs on a leash, keeping them at least 6 feet away from other people. Consider avoiding dog parks and other crowded public places. Though it doesn't seem like your animals can give you the virus, it appears you can give it to them. So if you're sick, avoid direct contact with your pets. If possible, have someone else care for them until you're well again. If that's not possible, be sure to wear a face covering and wash your hands before and after you interact with your pet.
Dave's Decorating Center is a proud supporter of the Power Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Fetcher's Pet Supply on the north side of the Charleston Square, serving the EIU community since 1991. Fetcher's welcomes all pets on a leash, is open 7 days a week, and offers made in the USA food. Pet supplies for dogs, cats, reptiles, and fish. Fetcher's Pet Supply in Charleston.
Finding a solution for your pet's behavior problem can be confusing. Dr. Sally J. Foote helps you help your pet. Private consultation and resources are available at drsallyjfoote.com. Foote and Friends, better bond, better behavior.